Good afternoon and welcome to the first Trans Forum of 3 for this year's Refugee Week series. My name is Maria Casaniti and I'm the manager of the Transcultural Mental Health Centre, a New South Wales Health statewide service. The centre's focus is to work with health and related professionals and a range of organisations to promote and enhance the mental health and well-being of culturally and linguistically diverse communities. I begin with acknowledging the Darug people as the traditional owners and ongoing custodians of the land. I pay my respects to the Darug elders past and present and extend that respect to First Nations people that may be with us here today. As we are online, I want to also acknowledge the many traditional countries and language groups that everyone is meeting from today. At the Transcultural Mental Health Centre, we celebrate and embrace diversity. So from the world's oldest continuous cultures of our first Australians to the cultures of our newest arrivals from across the world, we acknowledge people with lived experiences as refugees or migrants and their families with us today, and the courageous journeys of many generations of Australians who have made our country what it is today. The Centre also acknowledges the individual and collective contributions of those with varied and living experiences related to mental ill health and psychological distress, and those who have loved and cared for them. And during Refugee Week this week, we also acknowledge the strength and resilience of refugees, those seeking asylum, displaced people in their search for a life free from fear and persecution. We recognise the unique experiences of their journey. We support their arrival and settlement and meaningful participation in Australia. Thank you again and a warm welcome to all our participants today who come from various health, mental health and related social services across the wonderful state of New South Wales. Thank you also to our speakers today, Deena Mehjabeen and Associate Professor Shameran Slewa-Younan. World Refugee Day 2025 is this Friday. This year's local theme for Refugee Week, coordinated by the Refugee Council of Australia, is Finding Freedom, Diversity in Community. The theme draws attention to the vital role that communities play in supporting individuals with refugee backgrounds, offering strength, connection, and a genuine sense of belonging. It invites us also to reflect on how freedom is not just about safety, but also about reaffirming dignity, identity, and mental health in a new environment. The New South Wales Refugee Health Plan 2022-2027 recognises that meeting the health needs of people from refugee backgrounds is critical to successful settlement and integration. As mental health professionals and researchers, it is important to recognise that while the psychological effects of displacement and trauma can persist, so too can the remarkable resilience and hope that individuals bring with them. The Transcultural Mental Health Centre's Refugee Mental Health Program supports both clinical and community capacity building for service providers in our mental health and community services. It contributes to the important dialogue in this space, deepening our understanding, promoting equity and centering the voices and needs of those most affected. During this week, the Transcultural Mental Health Centre has invited researchers to provide their insights, and today we are honoured to host Deena Mehjabeen and her supervisor, Associate Professor Shameran Slewa-Younan, who will speak about their current research. So the learning objectives that we have for this series is to support health professionals in one, learn about current research that can help improve culturally responsive and person-centred approaches to support the mental health and well-being of individuals with refugee and asylum seeker experiences. And secondly, in learning how best to empower individuals with refugee and asylum seeker experiences with strategies to connect with community, self-care and health literacy. Now, a reminder that we are recording this session as a learning resource and it will be shared on our website for future reference. Also, please be aware that we will be discussing some difficult issues, so please be mindful of how this might impact you and take care of yourself as well today. Now, let's start today with an individual story celebrating Refugee Week. Badri Rashid will speak of his refugee journey with his family. The video is approximately 2.5 minutes long and is part of a series of Finding Freedom. Thank you. So with this, we can see that the voice of the refugee is especially important in the current context. Refugee communities globally and within Australia continue to face discrimination, social exclusion and systemic barriers, all of which can significantly impact mental health and wellbeing. We recognise that individuals at the intersection of cultural diversity and at different stages of their migration and refugee journey experience unique and layered challenges. These personal experiences matter, and as practitioners, it is our responsibility to listen, respond with cultural humility, and provide inclusive, affirming care for the person in front of us, notwithstanding the larger social context that they reside in. At this point, let me now introduce Emmeline, a clinical psychologist and a mental health consultant at the Transcultural Mental Health Centre, working in the Refugee Mental Health Program. Emmeline's role includes providing training to mental health professionals to support them in delivering services that are culturally responsive and fundamentally better understand the specific needs and requirements of our refugee communities. Over to you, Emmeline. Thank you.
Thanks, Maria, and happy Refugee Week, everyone. As mentioned by Maria, I work within the the Transcultural Mental Health Centre's statewide refugee mental health program, which has a community and clinical component that work in tandem, taking a structured approach in strengthening the mental health of new and emerging populations. It is through that program we bring today's Transforum. The video shared, the video story we shared today, and we'll share across the week, is part of a longer video that you can find on our website, developed through the community component of the Refugee Mental Health Program. The personal journeys of Badri, Zara, Tetiana, and Banan, shared to Australia, is a powerful reminder of the human strength behind every statistic. Their story is not just about survival, it's about adaptation, healing, and building a future against the odds. So we begin our Refugee Week research series with Deena Mehjabeen, a PhD candidate, and her supervisor, Associate Professor Shameran Slewa-Younan, who will be speaking about the self-care recommendations to improve mental health among Arabic-speaking communities with refugee-like backgrounds in Australia. So let me introduce our speakers while they get themselves ready. So firstly, Deena Mehjabeen is a public health researcher and final year PhD candidate at the Translational Health Research Institute at the Western Sydney University. Her supervisor is Associate Professor Shameran Slewa-Younan, who is an Associate Professor in Mental Health at the School of Medicine, Western Sydney University. Associate Professor Slewa-Younan will begin with a general overview. Thank you.
Okay, all right. Everyone can hear me? Yes? And see the slides. Is that correct?
Can see the slides, slightly soft.
Okay, can you hear me now? I'll get closer
Much
to the
better.
screen.
Yeah,
Okay.
There we go. Thank you.
All right. Well, thank you so much for this kind invitation. Both Deena and myself are really excited to present this work today. As you can imagine, doing a PhD is a very long and sometimes quite difficult journey. So getting to the end where Deena has now submitted is very exciting, and sharing some of these findings is a wonderful opportunity. So I'd like to also begin by acknowledging the traditional owners of the lands. And as we're all joining remotely, I'm joining from the Dharawal people's lands. And so I also pay my respects to elders past and present. So as was mentioned, I've had the pleasure of supervising Deena over the last few years, as has Associate Professor Elsa Balana, who is also, I can see, in the audience, and she's also been co-supervised by Professor Nicola Raveley from University of Melbourne, and Professor Perjan Tahani from the University of Dohuk in North Iraq. So we have quite an interesting mix of supervisors in this PhD. So before Deena delves into the findings, I'd like to just kind of spend some time providing a bit of a context as to, why this work matters and how it really fits into the broader landscape of refugee mental health. Okay. Now, this slide is very much demonstrating the escalation of numbers of people that are being displaced worldwide. Between the period of 2021 to mid-24, the number of people that were displaced rose dramatically from 100 million to 120 million. As was said just a few minutes ago, behind each one of these numbers is an individual, and an individual who has, quite pressing needs for health and mental health care. What's even more concerning, I suppose, just to kind of make mention of, is that in 2024 was the 12th year in a row that these numbers have consecutively been going up. Related to this is this slide, and this slide basically says an important thing. What it's telling us is that the complexity of dealing with refugees around the world is no longer just related to conflict and war. It's very much made worse by a series of things, such as climate disasters, floods, storms, and so on. So what we're seeing in terms of displaced people is a combination of conflict, climate, and long-term instability that is happening all at once, making our responses to these needs even more challenging. Now, what research has shown us very clearly is that people from refugee-like backgrounds are more likely than others to have experienced challenges to their mental health because of the experiences that they have encountered in, pre-flight, during flight, and so on, and that these challenges often will translate into elevated rates of mental illnesses such as depression, post-traumatic stress disorder, and anxiety in general. We also know from research that this need, despite being high, is not usually the same in terms of when we're looking at rates of accessing professional mental health support. And then there are a number of reasons for this. So we know from research that things like language barriers, stigma around mental illness, not knowing how to navigate the mental health services, and sometimes just related to the services and whether they are meeting the needs of the community. These are factors that can sometimes result in people not accessing professional services. The other thing to make very clear here is that when we're talking about their needs, we're just talking about the needs that have occurred as a result of the experiences they've encountered in their homeland during flight. It's not just about past trauma. The stress doesn't just settle once they've resettled into their country. Things like social isolation, unemployment, and indeed ongoing crises that are occurring in their homeland continue to present challenges to these individuals, present the need for providing some kind of support and ongoing services to improve their mental health and well-being. And so this is why self-care is so important, because it presents a tool that is accessible, that can assist individuals and can complement formal support. So what do we mean by self-care? What do we, when we're saying the word self-care? Well, the World Health Organization defines it as the ability of individuals, families, and communities to take care of their own health. And whether that is in preventing illness, managing existing conditions, or just staying well. And all of this can happen with or without the assistance of a health worker. For individuals from refugee-like backgrounds, self-care can present as an incredibly empowering tool. It gives them the ability to use something in their daily lives that makes sense culturally and personally, and it can assist in supporting professional support or filling the gaps when that's not available. Why does self-care matter? One of the things that we all experience as health professionals is the challenge of scale. Simply put, there are more people in need than there are support services that are available to support them. And this is true both in the international setting and in the Australian system and in mental health systems. So this is where self-care can present an opportunity to assist. As I said, it is an accessible, flexible tool that puts people in control of their own well-being. It is incredibly important when we're talking about people who come from refugee backgrounds, because often they have experienced this profound sense of loss of control because of displacement. Self-care can restore a sense of agency and provide them the tools to be able to manage their own health. And this is incredibly empowering and can be healing. But of course, as you can imagine, self-care works in some communities, not necessarily this. So we really need to spend some time understanding what self-care looks like for different communities. So Arabic speakers were chosen for this piece of research because it is the third most spoken language in Australia following English and Mandarin. And we also know from research that those Australian-based research, that Arabic-speaking communities, particularly those who come from refugee-like backgrounds, will experience disproportionately high rates of mental illness. However, at the time of doing this PhD, there was very limited understanding about some of the self-care strategies that are actually preferred by Arabic-speaking communities. So that's where Deena's research came in. And so what she initially set out to do was to go to the literature and understand, well, what does self-care mean in Arabic-speaking communities? And then spend some time going deeply with communities and speaking to communities about strategies they were working with. And then the last study was looking at practices that fit into the Australian mental health system. And this is where I will pass it over to Deena and continue on talking about the specifics of her research.
Thanks, Shameran. As we know that Arabic is one of the third most spoken languages in Australia, and from there on, Arab ancestry is also one of the most commonly reported ancestries here, and the common or the key countries of origin include Lebanon, Iraq, Egypt, and Syria. Um, and then in this PhD, if you can move to the next slide, Shaman. In this PhD, there was 3 interrelated studies, as Shaman also mentioned. And the first involved mixed method systematic review to identify and synthesize the global research on mental health self-care strategies among Arabic-speaking refugees and migrants. We reviewed 57 studies that involved 37 intervention studies and 20 observational studies, and most were published post 2019. And from there, we found that there were 4 broad categories of self-care strategies that involved social, psychological, religious, or spiritual and other strategies that involved activities like expressive arts, physical exercise, or pursuing leisure activities or hobbies, such as traveling or going to the movies, such things. And largely, these strategies were found to be helpful, but some participants also mentioned that they faced some challenges in practicing them. Next slide, please. And then, since the systematic review was a global that gave us a global understanding, we wanted to then follow it up with a second study that provided us with some ideas about what are the local self-care experiences among Arabic-speaking individuals. And we focused on southwestern Sydney, mainly because of the number of people living there from this community. And we conducted 4 focus group discussions, and they were mainly, they were done online via Zoom, and they were carried, we had 21 participants, so 11 women, 10 men, and it was divided by gender, so 2 groups with the male participants and 2 with the female. And it was carried out by 2 bilingual facilitators who spoke the language and already had knowledge and then rapport with the participants. And through this study, we explored self-care activities for managing stress in Australia and participants' home countries, and the different challenges they faced while practicing these self-care strategies in Australia. Next slide, please. So this slide shows mainly some of the community participants' quotes, and they mainly talked about the different strategies that we already identified in the systematic review. So, for example, the first quote, I'll read that one out. They talked about in social strategies, mainly it was about having connections and maintaining communication with family members, whether it's in Australia or overseas, either in person or phone calls, keeping in touch on social media, and socializing, so visiting friends and family, going out to restaurants, cafes, and also the women mentioned during the discussions that they spent a lot of time at home caring for children or spending time with them that made them feel better, and also with extended family members. For example, this first quote expressing social strategy. So, 21-year-old Christian woman from Iraq, she mentioned that when I get stressed, I try to immerse myself in my home duties and get busy with my children. I have twins, or I call my parents. That's how I manage my stress. I try not to get stressed by engaging with my children. I spend the day talking with my children and playing with my children. The day passes by being busy with the children. And I'll move to the next slide, but these are some of the quotes that we found. And finally, coming to the third study, it was a Delphi consensus study, and we conducted that to gain an understanding of what self-care activities could be found helpful. So to gain the expert consensus on culturally appropriate mental health self-care recommendations for Arabic-speaking individuals with refugee-like backgrounds in Australia that were relevant across the Australian mental health step care model. And the panel involved two groups, so the Arabic-speaking community members with refugee-like backgrounds and the health professionals serving this community. So the table here shows the criteria that we followed to include the panelists. Next slide, please. So in this model, the four settings that we talk about, the four care settings are described here. So the base of the pyramid that shows the informal community care with or without professional support, and then primary or generalist care, which can involve GPs or the primary care clinics, and then the third one is community-based mental health services, and finally hospital-based mental health services. And we asked the panelists to rate a list of self-care activities that we found from studies 1 and 2 to rate them across those four settings. So coming to the Delphi study, the Delphi technique is an iterative process to achieve consensus among a panel of experts. And this involved four main steps. So framing the research question, establishing the combined panel in this case, and then developing and distributing a questionnaire, and then analyzing and reporting the results over 3 rounds. And the figure here, it's a part of the questionnaire that we developed. So this is how it looks for each of the activities. Next slide, please. So in terms of the Delphi panelists, we had 28 Arabic-speaking community members, and then the health professionals, there were 15, and for community members, mostly for both the groups actually, most were female, and for the community members, mainly they were from Iraq, then also Lebanon and Syria, and health professionals mostly they were based in New South Wales, and many had a background in psychology. Next slide, please. In terms of the endorsed self-care activities that the panelists rated, there were 75% agreement to the consensus, and we had 73 self-care activities. So of them, the panelists endorsed 46 across the 4 care settings. And then of these 46, the following endorsement was there. So at the informal or community care setting, it was 45 out of 46, and then primary or generalist care 28, community-based mental health services 18, and then hospital-based services were 4. And from these endorsed strategies, we could say that there were 12 of the social strategies, 14 psychological, 4 religious, and 16 other strategies that involved healthy lifestyle, hobbies, acts of service or responsibility, and miscellaneous. So within miscellaneous, we put in like things like studying or pursuing an education, learning English, such activities. We could move to the next slide. So these are some of the examples of endorsed self-care activities. So social would be having meaningful conversations with family and friends. Then religious would be praying, and then gardening and connecting with nature at the bottom, that we put in other self-care strategies, whereas having personal or professional goals and working towards them, practicing mindfulness, we group them in the psychological self-care strategies. Next slide, please. So this again kind of illustrates some of the examples in terms of the different types of self-care as it's color coded. So the blue would show social activities, so having meaningful conversations with family and friends, spending time with people of the same culture, religion, and then also across the 4 care settings. So we can see that most were across the informal community care, whereas very less at the hospital-based mental health services. Next slide, please. So in terms of recommendations, we could group them as informal community care settings, and then formal care settings that would involve the primary generalist care services, community mental health teams, and hospital-based clinicians. So in terms of that, it can be said that within the informal care settings, alongside the person involved, so alongside the individual who can practice self-care, we can engage their families, friends, community members or community leaders, and maybe settlement organizations, community organizations, to help involve them or promote the self-care activities, and also that could help with mental health and well-being. With formal care settings, these could be alongside the family members and community members in their involvement, the formal care setting and the generalist care setting, their involvement, the service setting could help also to promote and make them more meaningful for those involved. Next slide, please. So in terms of take-home messages, we could say that this research helped identify culturally relevant and appropriate self-care strategies for this community, the Arabic-speaking individuals with refugee-like backgrounds, which was aligned with, or that was found relevant with, the Australian mental health self-care model. And these strategies or the recommendations could then also help inform us and help develop the self-care guidelines to eventually support mental health and well-being and promote more inclusive and culturally responsive services. And although the research focused mainly in the Australian context, the findings may be transferable to other Western resettlement settings, and further research is needed within the Arabic-speaking populations to see what would be more applicable across other age groups and other genders. Because in terms of age group, for example, my research focused mostly on middle-aged or older adults, the participants that were involved. So it would be good to see what would be applicable, or what would be useful for other age groups, younger age groups, perhaps younger adults, and then other genders or geographical locations. Because for us, it was like more New South Wales based, could say. So maybe into regional areas or rural areas, that could be also helpful. And yeah, next slide, please. So in terms of acknowledgement, so I would like to thank the participants for the Delphi study and the focus groups, who were very kind and generous with their time and helped with the study. And then the bilingual facilitators and translators, and my supervisors, Shameran and Elsa, who are here, and also Nicola and Farjan, my external supervisors, for their feedback and guidance throughout the research. Thank you.
Thank you so much, Deena and Associate Professor Slewa-Younan, for that insight into Arabic-speaking refugees. Can really see how rebuilding life and emotional well-being is shaped by faith, family and culture, with community-driven self-care playing a vital role in mental health after resettlement. So while today's presentation explores these experiences, I guess it's remembering elsewhere also that not everyone within a culture shares that same story, and some others from other backgrounds might be able to rate as well. I might get you to stop sharing screen if that's okay, Associate Professor Slewa-Younan. And so what I wanted to have up there, but it might come up in a second, is just around the refugee mental health program, so that if you can't stay, but hopefully you can for question time, that you can learn more from our website, which will come up. Yep. So what can I do to learn more? So we've got our website, the QR code's up there, or if you can get the link is also on the screen. The other thing is we also value feedback. So please scan the QR code to complete our evaluation, which is the next slide. And also let us know if there's any topics or ideas for future webinars in this space. So we have quite a good amount of time, around 20 minutes, to answer questions raised through registration. So I'm going to have Deena and Associate Professor Slewa-Younan to respond. So I guess in terms of the first sort of questions that I thought would be interesting in relation to what you were talking about, was just thinking, we okay? Okay. I mean, I'm almost more interested in how this worked with talking to the community members around how you explained the concept of self-care with those from the refugee backgrounds.
Yeah, so I could start. So when we shared about the study to the participants, we kind of wanted to simplify self-care as a term. So we said, what are the activities that you do generally or in daily life to look after your mental health, or that you find useful to do so, things like that. And then I remember when we were doing the focus group discussions, like because it was kind of facilitated by Arabic speaking facilitators, so they kind of also, if they couldn't, if participants found it difficult to understand, then maybe give some, like one small example, personal example. Like for example, when I came to Australia first, I used to do this, or like buy calling card to call my family, like things like that, to make it simple for participants so they could relate and then also answer.
Oh, great. Yeah, because I guess that's one of the things that can be difficult, is trying to work out how do we have these conversations without using too much jargon as well. Even self-care, I guess, can be jargon when it doesn't potentially doesn't translate. Because I guess that was one of the other questions which you've kind of spoken to, was around how do we avoid giving that advice on how they need to self-care and recover from their experiences. Yeah, I don't know if you can speak to that, so to speak, but I guess it's about trying to, how can we best empower them and their families? Yeah.
I think it would be like maybe I think with self-care, what we found in the research was mainly that things we are already doing, maybe the families are already doing it, like meeting friends and family or praying, they're already practicing those things, but then also pointing it out that these are the things that you do, but also in terms of making them more socially or culturally relevant, and also asking that what else do you find helpful. So maybe that's how we can empower the kind of validating that you're already practicing them, but like you could do them more maybe, or when you're feeling down, this is how you could like in doing these activities could be helpful, like that.
Yeah, great. Was there something that you wanted to add there, Associate Professor Slewa-Younan?
Oh, I was just going to simply say that Deena's correct. It's the language we use. I think we've all spoken to this, is so important, and making it as simple and accessible and user-friendly, and to also ensure that what we are suggesting rings true to them. So, identifying that these are things that perhaps they're already doing or have done, or others very similar to you have done, and maybe these are things that you may find helpful, and not enforcing it or pushing it on, but saying simply that these are the things that some of this research has indicated these are useful things. Have you considered this? But our language is very, very important, as you can imagine. So
Yes. Yeah, great. Thank you. So was there kind of a side question, and this has come out from the registration, was there any sort of self-care activities that surprised you, that were either strongly endorsed or rejected?
Yeah, so in the Delphi study, when the panelists did the endorsement for the activities, I would say with the ones that were endorsed, like being connected with family more, or prayers, or attending religious activities, these did come out consistently through the other studies, the previous two studies as well. So these kind of helped us affirm that yes, these are helpful activities, or culturally relevant. But I think that were rejected, and it was interesting to note that like the digital activities, maybe like browsing social media, or looking through the internet to find information maybe, and then like leisure activities, or arts based activities, they weren't endorsed. And I think when we were looking through that, and we thought it could be because of the panelists, like who were involved, maybe they didn't find it practical enough to be endorsed or not relevant for their like daily practice for the community members, I'd say, because they were mostly like in the older age group. So I guess that could be one of the reasons. But yeah, with the ones that were endorsed, we thought it helped us affirm the previous results. So yeah.
So adding on to that, just simply saying that the endorsements were very consistent, and I mean, obviously we allowed the research to unfold, but it was kind of consistent with study 1 and study 2, but it was the rejection. So that when we were presenting the activities and then saying to the panel, have a look at these, tell us what you think are feasible and to be done at these steps, and it was those that were rejected that really kind of made us, some were quite clear, and we as clinicians kind of thought, yeah, that makes sense, not going to social media. We all, I mean, it's a very
topical at the moment.
Topical, and I don't think anyone's ever solved whether it actually makes things worse or better. Depends on your viewpoint. But yeah, I mean, that was quite clear. But some of the stuff like, creative pursuits, that was interesting. We thought that would be picked up, but it wasn't. So like Deena reflected, it could be a response of the people that we were in our Delphi panel, age groups and experiences. Maybe if we did a similar thing with much younger people, it might be a little bit different. So that was probably an interesting finding.
Yeah, that does sound really interesting. And I guess that's where you kind of led to your conclusion about trying to look at different ages, looking at gender, location, rural. So really looking at that sort of making sure, I mean, and I guess that's the hard part, is trying to be able to get everyone's voice heard. So kind of leads to the next question. I mean, whether or not you can answer this, I don't know. How might these recommendations then be adapted for other, I guess, language groups or other culturally and linguistically diverse / refugee groups in Australia? Has there any been thoughts to that? Not really. It's a bit of a tough one.
I think it's currently, because we are focusing on the Arabic-speaking communities, I think if we follow on from this piece of research, then it would be probably looking into, like I mentioned before, maybe extending it to other age groups or locations. But based on that, if you've done, because as we said, needs more research, I guess, more work to look into, and if we can then, based on the recommendations, work with the community to maybe come up with guidelines also. So then based on that, going further, we could maybe look into other communities. Yeah.
I think taking away from this is that we've found some general principles, and these are the principles that apply to these communities that were very specific that we looked at, and that these principles applied within the Australian, that this is what was feasible across the different settings of mental health in Australia. I think, as we do with everything, when we're working in this extremely complex but very, very interesting space, we need to approach it with that idea that, we have this cultural humility, and that we are also saying, here is what we found that was done with this particular piece of research. If we're working with different communities, it doesn't mean that this is applicable, but I'm talking about if you're just a general kind of clinician who's not about to launch into a piece of research. Obviously, further research is needed, but, I mean, if you could say things like that, here's what we found if you're working with an Arabic-speaking consumer who's come from a refugee background, but might not necessarily be an older person based in southwestern Sydney, maybe a bit younger, based in Orange, for example. Here's what this research has found. Do you think any of these might be suitable or something that you could pursue? So it's complex. I think we already recognize.
Yeah, I think we got, but it is, I mean, it's a great starting point for when you are working with someone of Arabic speaking background as well. So, and I guess it is kind of giving you a little bit of guidelines then to kind of think about when you are working with people, and we are complex. That's what we are as humans. So I guess, is there any plans, I guess, in terms of how you're looking at sharing your research findings, Deena, to sort of, aside from doing a transforum like this, was there any other things that you're planning on doing?
Yeah, so at the moment, I'm preparing to in the process of working on paper based on the study, but also to make it more accessible, like also share it with community organizations, for example, Transcultural Mental Health Center, and also like Arab Council of Australia, because they helped with our participant recruitment. So we're also approaching them to help share the study findings. So yeah, more I think with sharing through community organizations. I think that would, and in Arabic, sharing the summaries in Arabic, and I think that is our priority with like sharing the study findings. Yeah.
Yeah, great. Were you going to add something there, Associate Professor Slewa-Younan? No, you're just nodding.
Yeah, just basically going on to making sure that initially we go back to the community. That's really important, and we've spent some time trying to make sure that the findings are written up and provided in a very easy to understand language in Arabic, and then obviously the usual academic channels, papers, conferences, forums like this. But yeah, community is our first priority, and then papers.
Yeah, great. Thank you. Was there any final sort of words that you wanted to say or comments about your PhD now that you've completed it and submitted?
I'd say, as Shameran also mentioned, when we were starting out, we weren't sure what is out there in terms of mental health self-care, because I know that when I was reading, there were studies like this in other refugee communities, there's East African refugees, and it was interesting to read that. But then as we started, as I also looked into the Arabic speaking community and all that we found so far, I'd say that it does align with other refugee groups, other communities, the self-care strategies or coping strategies, and also the different terms in research for self-care. So these things, I would say that I found interesting during the research, and also working with the community and engaging with them, being like, for me, I don't speak Arabic, but working with my facilitators and the community, and I found them, the community members, very helpful and very supportive. That they, given that I didn't speak the language, they were very friendly and helpful. They wanted to help. Okay, what do you need help with? When I was doing the questionnaires with them and all of that. So I thought that was a very enriching experience, and yeah, I would say a bit ups and downs, but it went. I reached there.
You've reached the end. You've done an amazing job. Yay.
Maybe reflecting on the fact that Deena started this, and then we went into that huge lockdown. So we had to really quickly think about how could we do some of this community-based work while we couldn't actually, sit in the room with community, certainly for State 2. So that was really interesting and challenging, but yeah, absolutely. Yeah. Did a really good job.
Yeah, well done. And I guess that's the thing. Congratulations, before I forget to say that.
Yeah.
Well, look, thank you so much for being our speakers today, Deena Mehjabeen and Associate Professor Shameran Slewa-Younan, and being part of this Transforum. please feel free, I guess I'm kind of coming to a conclusion here. Please feel free to get in touch if you have any other questions that come up following today's webinar. As mentioned, we will share the recording on our website alongside the other webinars this week. So we hope you can come along tomorrow for Professor Belinda Little's work on neurobiological approaches to understanding refugee trauma and post-migration stress. And I hope today we have all been able to hold space for both the science and the story, the data and the deeply personal, as this matters when it comes to providing culturally responsive, trauma-informed and person-centered care. Happy Refugee Week, everyone, and wishing you a great day ahead.
Thank you.